time for another in our series of Top 40, Under 40, talking to those people who are shaping and changing the lives of all of us who live in this city. Today, we're going to spend a little time in conversation with Vanessa Fowler, to whom a lot of people are comparing her to Florence Nightingale. As a matter of fact, so many people were comparing her to Florence Nightingale, she registered a company called Nightingale Patient Care Advocacy, after the Victorian-era nurse who was so famous looking after soldiers during the war. Vanessa Fowler, good morning to you.
Good morning. How are you?
Well, I am thrilled to meet you because I'm one of those who has a 90-plus-year-old mother living in care, not close by. Mm-hmm. And we all worry about how our senior is being looked after, how our loved ones are being cared for.
Absolutely.
And it sounds to me like you stepped in at just the right time.
I believe so. Yes, I definitely saw a big need as the baby boomers are getting older, their parents are living longer, and basically it's our healthcare system is just getting a bit more bogged down, and there was definitely a need for somebody outside to be able to offer an extra service for families that are in this situation.
How do you work this? How do you operate? If I contact you and say, listen, I got a 93-year-old mother who stays in XYZ house in Kelowna, then what happens?
So basically, you'll get a hold of me, and we do a kind of a consultation interview, depending on the level of care your mom's in, whether you're her health representative or is she still of sound mind. Depends on who actually gets to hire me.
Who amongst us is of sound mind?
Good point, right?
Sorry.
So pardon me, yeah. So anyhow, if your mother, say she had dementia, mm-hmm. usually there's a health representative that's actually appointed to her. Mm-hmm. So that would be the person who would have to hire me. But usually in this case, is like a sibling, or not a sibling, but a daughter or a son might be appointed that role. And if they're feeling overwhelmed and they want an advocate to come and oversee their mom's care, you would sit down with me. We'd actually go over all the needs of your mom, and I can actually go to the facility and make sure that she's getting all her rights met and
now,
so on.
For you, at the roots of this was years as a registered nurse. So obviously you are sort of woven into the healthcare system. You had plenty of time to see how things were going sideways or how things weren't working.
Yes. I've been an emergency room nurse since 2004, so I've definitely seen all age groups, lots of varieties of illnesses and injuries, and I've just noticed that the healthcare system is offering a little bit less and less as the years go by, and there's a shortage of nurses because a lot of our older senior nurses are retiring because they're in that baby boom age. And we are seeing a lot more elderly people living a lot longer, up to like 100 years old. So it's just this growing need for extra services.
Are you overwhelmed?
Am I overwhelmed? Well, right now I know I'm going to be having to bring on more onto my team because there's definitely a huge need here in Kelowna, as across Canada. But I want to get more nurses on board who specialize in different areas, because my specialty is a little bit kind of like the jack of all trades,
right?
Master of trauma.
So I'm the caregiving child, if you will, who's got the power of attorney, et cetera, et cetera, et cetera. Not going to go into all that. Mm-hmm. But we reach a deal, and you say, okay, I'll be your advocate because you're living in Ottawa, mm-hmm. and I'm here in Kelowna, and I'm going to keep an eye on your ma.
Yes.
What does that look like then?
So if she has appointments or anything, I will make sure that we can make the best use of any doctor's appointments. I will go and attend any of her x-rays or lab appointments. Mm-hmm, mm-hmm. I will follow up with the family and make sure everybody's kind of on the same page, knowing what's happening with their loved one. I will also make a point to have all the healthcare like the doctors, the nurses, if there's physio or whatever, make sure that they're all communicating together, because some of these places are private. They're not all using the same system, so people are not always talking, and that's where I feel like people can kind of fall through the cracks.
And then how do you report back to me? Is it by phone and verbal? Is it written by email? I'm in Ottawa, girl. I'm a long way away.
So I offer a monthly health report. I also do an online Zoom. So it's kind of like a Skype thing where we can actually see face-to-face on a computer and we can talk about everything. Or I can do an email. So whatever works best for the client.
And how much is this?
I am charging $85 an hour.
Right.
Now, there are some grants out there, depending on, again, what your illnesses are or what you're connected with. There are sometimes funding to be able to put towards services like this. So, again, somebody would have to call me and we'd have to go through that.
Sounds like you're enjoying what you're doing.
I love it. I love it. This is definitely giving me a chance because RNs, we are advocates. That's what we've been trained to do. And I feel working in the public system, it's just so busy that I can't spend that extra time that I wanted to with families. So this is actually giving me that opportunity.
Listen, it has been a pleasure to meet you this morning. Vanessa Fowler is the owner and the proud proprietor of Nightingale Patient Care Advocacy. You need her services? Just go to Google and type in Nightingale Patient Care. It'll get you exactly where you need to be.